So welcome back. Here we are talking about prone position. In prone position, the patient lies on their stomach like it is here. So the head is in a neutral position and turned to one side. Yeah, one side. Nurses can place a pillow under the abdomen or other areas to increase comfort. So this position is very useful because it allows the hips and the knee joints to extend fully. Knee, joint, and the hip to extend fully. It also helps patients who are unconscious to promote drainage from the mouth. For pediatric patients, the prone position helps in gastroesophageal reflux disease. This position can work for vascular surgeries, neurosurgeries, and neck surgeries, among others. What do you need to watch for when the patient is in this position? We are saying RN should not use this position for patients with spinal injuries, as it creates a forward curve in the spine. RN should watch for potential complication such as compartment syndrome. Thank you so much, and that is how to place a patient in prone position and how it is used. Okay, thank you.